Great. Good morning, everyone. My name is Maïté Verloigne. I'm from Ghent University. And first of all, I would like to give a warm welcome to everyone who is present today at our first Health Cascade event. Maybe in the beginning we will still have some beeps, but hopefully everyone is now here and it will stop beeping. Okay, I will give you a bit more information very shortly about the overall design of Health Cascade. I promise to keep it short because we have a lot of fantastic speakers today and interactive discussions, but I think it's relevant just to give you an idea of how the program is built and what it contains. It is a Horizon 2020 program and more specifically in innovative training networks projects. And before we go into the specifics of Health Cascade, I just copied the general objective of ITN projects to remind us of what it contains. So the aim of these training networks project is to train a new generation of creative and innovative early stage researchers able to face challenges and to convert knowledge and ideas into products and services. And I remember, I think it's 2 years ago or already 3 years ago, that with our initial small consortium of co-creation researchers, we came into this opportunity and we realized, yes, this is it. This is what we want to do with co-creation. This is how we want to elevate co-creation for public health. And luckily, Horizon 2020 agreed with us and they funded our project. And of course, for such a European project, you need to see it big. And I think that's proven by the numbers, which I will show you on the next slides. As Seb mentioned before, we have 7 beneficiaries from different academic disciplines. We also have 18 partner organizations, and 18 is a lot, so they are not, I was not able to copy them all on one slide. So the 8 remaining organizations will be on the next slides. And these partner organizations, they are from different sectors, they have different expertise, and they are really important within this kind of project because they, on the one hand, they can deliver training for the early stage researchers, but they will also host early stage researchers within their organization. So we're really happy to have a lot of fantastic partner organizations. The 7 beneficiaries and the 18 partner organizations are spread across 8 different European countries. Also, we have 5 highly reputable researchers who agreed to be external advisory members within Health Cascade, including Professor Michael Wright, which you've seen before. And we have, after a very intensive recruitment process, 15 early stage researchers who will pursue their PhD as part of Health Cascade. And I know some of you are present today, so a huge welcome to all of you. And last but not least, I was not able to put a number on it, but we have a lot of people who are interested in Health Cascade. And I think we can really speak of a Health Cascade community, and we hope to see you on future events and also to collaborate with you in the upcoming years. So also welcome to all of you that are present today. We see you as part of our Health Cascade community. Okay, we have 3 objectives within Health Cascades. The first one is to advance co-creation into a rigorous methodology. And I think the mammoth that was part of Seb's presentation is really what we want to do with it. So this first objective is addressed by our research program. And then we have the second objective is to really train, because it's a training network, to train the next generation of research leaders in using co-creation methodology. So in using this scientific, rigorous methodology. And that is addressed by our training program. And then our third objective is to develop a shared European cascading training system for evidence-based co-creation. So based on the scientific product from our first objective, we want to collaborate as a cohort to develop a training system that can be widely disseminated afterwards. So you can really see this training system as an exploitable product of Health Cascade. Just to give an overall impression of how the research program, the training program, and the exploitable product is linked to each other, I have copied this figure from our proposal. It might not be the most visually attractive one, but it shows how everything is connected. So we have the core of Health Cascade, work package 1, who is really about developing that evidence-based co-creation methodology, including theory, ethics, methods, implementation, and evaluation as the foundations of that methodology. And there we have 4 ESRs, or early stage researchers, who are part of that work package. Then we have the second circle, the work package 2, that focus on developing or creating technologies that can facilitate or support that co-creation process. And then we have our 4 sectors of civil life in which we will test these methodologies and technologies. And then, of course, the training program, work package 7, is part of Health Cascade as well. And then, as mentioned before, the 15 early stage researchers will really work as a cohort, as a team, to develop that cascade training. And that is addressed by work package 8. And work package 8 is led by Later Life Training, who is one of our partner organizations and who have a lot of expertise in cascading training systems. Then we have 3 other work packages who are also part of Health Cascade, focusing on dissemination, coordination, and ethics and data management. This figure, I just want to show this to you because this process of developing the co-creation methodology is not a linear process, but it's really an iterative process. We will develop a preliminary methodology. It will be tested in the 4 sectors. They will give feedback and inputs. They will refine the methodology. It goes back to the 4 demonstrating work packages and so on to finally end with that co-creation methodology. However, I also think that within Health Cascade, to really create that methodology, it's also important to get input or to get feedback from other experts outside of Health Cascade, people like you who have experience with co-creation, with public health, with technologies, to really build an evidence-based co-creation methodology. Of course, it is a training network, so the training program is as crucial as the research program, and it will be a very intensive PhD journey. We will start with 15 early stage researchers who are at the beginning of their career, and we will end with 15 leaders in the field at the end of Health Cascades. In Health Cascade, we will target more conventional research skills related to public health, scientific writing skills, and so on, which is normal for a typical PhD journey, but we will also target these unique research skills that are important for co-creation. These true co-creation skills, such as how to facilitate co-creation in diverse groups, how to foster creative out-of-the-box thinking, and also train researchers in using participatory research methods such as photo voice. And within Health Cascade, we have different training components that will be used to target those skills. We have, of course, the training through research projects. Yeah, this is the 15 individual research projects per researchers. We also have the secondments to the academic and the non-academic sector. So as mentioned before, the early stage researchers will be hosted by other beneficiaries or by other partner organizations to really ensure a broad perspective on co-creation, on public health, on digital technologies, also to enhance workforce experience, and also to create the opportunity for our researchers to build a diversity of practical skills and to really build a professional network in the non-academic sector as well. We will have writing retreats, workshops as part of our network-wide events. There will be co-learning and co-working events for the ESRs to really build to that methodology and to that training system. We will have webinars such as today. We will present and attend international conferences, and we will have one-on-one mentoring systems for the ESRs. I think within Health Cascade, we want to broaden this training program further than just our 15 early stage researchers. So we hope to be able to invite you to some of our future training components and to be able to work with you in the future, because we think that working with a lot of different people from a lot of different disciplines will really help us to succeed with Health Cascades. This is it. Thank you very much. And I will give back the word to Griet.